Hi, everyone. Thanks for joining the webinar. I know people are probably still grabbing a quick lunch, so we'll give folks another minute or so before we get started. Okay, I think we can go ahead and get started. A quick thumbs up if everyone can see my presentation up on the screen. Perfect. Okay, I guess we'll get started. Hey, everyone. Thanks for joining us for OCAPA's September webinar. Today, we're excited to host a session on creating equitable and healthy general plans, tools, strategies, and best practices for embedding health and environmental justice. We're joined today by Miguel Vazquez of the Riverside University Health System Public Health and Tiffany Eng of Ramey and Associates. Before we get started, did want to give everyone a heads up that we do have other webinars coming up through the end of the year. Next month, we have a session on creating equitable and healthy general plans. In late October, we have a webinar on community sustainability and resilience, followed by a webinar on SB9, so stay tuned. You can stay in the loop by signing up for our email list at ocapa.org or on Instagram at APA_orange_section. So today's webinar dives into health, equity, and environmental justice principles and how to incorporate these principles into our long-range planning efforts. We as planners do have a special responsibility to serve the public interest, expand choice and opportunity for all persons, and plan for the needs of the disadvantaged. Here on the screen, we have a few excerpts from the AICP Code of Ethics and Professional Conduct, just highlighting examples of how planners must address equity through our work. And today's presenters will provide just a snapshot of some of the ways this responsibility can be met through the work we do day to day. So our first presenter is Miguel Vazquez. Miguel serves as a health equity and regional planner at Riverside University Health System Public Health. He focuses on strengthening the integration of planning and health equity through collaboration with non-traditional partners, data analysis, and community engagement. His recent work focuses on the integration of healthy and equitable communities through planning at the regional scale. Our second presenter is Tiffany Eng, a senior associate at Ramey Associates. Tiffany's experience includes community organizing and environmental justice planning, working on grassroots campaigns, healthy cities and communities, organizational leadership, and capacity building. This has included working with the California Environmental Justice Alliance to pass SB 1000, which created the environmental justice element of general plan updates. So just a quick note that we have set aside time at the end of this presentation for questions. You can use the Q&A button that I've circled in red anytime during the presentations to ask your question. And at the end, we'll give a chance for panelists to provide their insights on each one. And with that, I will hand it off to our first presenter, Miguel. Miguel, it's all yours.
Thank you so much, Michael. Thank you so much, OCAPA. It is a privilege to be able to share with you some content that I've learned over the years as I started my journey, particularly working for our organization, which is the Riverside University Health System Public Health. A little bit about organization. We are the actual Department of Public Health for Riverside County. And the reason we have the name Riverside University Health System is because the system also incorporates behavioral medical center in our so I heard Michael speak. Is it all good? Can you give me thumbs up, somebody?
Oh yeah, sorry. Are you having trouble controlling the slides? Or do you want me to?
No, I am good. I was just making sure that people were listening
Yeah,
because your
we're
connection
all
was a
good.
little spotty earlier. So
No worries,
anyway,
loud and clear.
thank you, Michael. We serve 2.5 million people who live in 28 cities in many unincorporated communities. My journey working on equity and environmental justice really, I can't really tell you exactly when it happened, but the idea of equity was crystallized when I started working on a large project by the California Endowment called Building Healthy Communities. And that was an effort to improve the, the, the health status of some of the most disadvantaged communities in the state of California. And we have one site, or well, at the time we had a site, and that was the Eastern Coachella Valley, which included the city of Coachella and also the communities of Mecca Thermal and North Shore. And when I started that journey, actually, I would say right before that, we were also working very closely with Ramey and Associates, and you will hear from Tiffany after me. But Ramey and Associates also was the consultancy that helped the Riverside County Planning Department develop its healthy communities element. And that was an optional element that the planning department at the time decided to incorporate. And we like to claim that we were the first county in the nation to have this type of document in our plans. I would say that as a result of that leadership that we had at the time, we were able to secure that grant from the California Endowment. And one of the main activities that we had was to collaborate with the city of Coachella when it was developing its general plan health and wellness element. So that was, I would say, a project that we conducted in a way that we hadn't done before. Now, now you're looking at these slides, and this is, I will say that one of the former employees from Bremen Associates, Beth Altschuler, she gave a presentation and she shared this particular image at the top left, and probably many of you are familiar with that. And this illustrates the difference between equality and equity. And basically, equality, the idea is that everyone gets the same, and equity means that people receive the right fit for your needs. And you can see that there's different iterations of the same idea through other organizations in other visionaries that are helping to help us understand the difference between equity and equality. I'm not going to focus on these quadrants today, but when you get the slides, I would encourage you to take a look at them and study them so that you can begin to ponder as to what the differences are between equity, equality, and then at the bottom quadrant, you can see also the idea of inequality and justice. I'd like to bring your attention to this model, which I've used for a number of years. It's called the BARHI Public Health Framework for Reducing Health Inequities. BARHI is the Bay Area Regional Health Inequities Initiative. This schematic was developed back in 2015, and this model intends to convey the idea of how different stakeholders who want to make their communities healthier and more just can come together to address the causes for injustices and inequalities. To be able to read this diagram, we're going to walk through all of it, and I think we have ample time to not dive too deep into it, but to explore its content. But this is how you want to approach this framework. First, at the top, you'll see that arrow, which depicts the idea of how different organizations and individuals can work downstream, and also they can work upstream. And downstream, for the purpose of our conversation today, is the moment in which people throughout their lives, they may be experiencing different conditions that will lead them to have a shorter life. In working upstream on the opposite end is how people can work together to address the root causes for which people may live less than what they should. There is this idea that your zip code or zip code can be a more consequential factor for health status and also for how long you live than our own genetic code. And that was another lesson that I learned through working with building healthy communities. And I think Tiffany will share some maps that can explore that idea. So in the work that we do as planners and public health professionals, there's certain areas that are, I would say, very particular to our professions. But the first one, let's just look at this idea of the current public health practice. And again, this was done about 10 years ago. And at the time, we knew that public health, by and large, would focus on addressing risk behaviors like smoking, poor nutrition, addressing physical activity, violence, alcohol and drug use, and sexual behavior. And the idea is that by addressing those behaviors, we have a good chance to prevent disease and injury, which are expressed by communicable diseases or chronic diseases, and injuries, be it intentional or unintentional. And the result of that is mortality. People die because of these causes. But then we'll look at this block, which is the idea of the emerging public health practice. And this is the place or the area in which we have an opportunity to collaborate between public health professionals and those in charge of shaping the built environment. And planners, that is our big task. So let's take a look at what we have. So if we want to look at the root causes of why is it that people may be behaving in a certain way, or why people may be having more types of diseases in one area than other areas, we need to look at the reasons. And in this model, we see that social inequities is the biggest piece for which we have detrimental conditions for certain communities in our region. And when we talk about social inequities, that means that we need to think about the relationships between people when it comes to their class status, their race, ethnicity, immigration status, gender, and sexual orientation. And at the end of the presentation, I really want to hear your comments and ideas and your reactions to the model. So I'm not going to spend too much time on this. I think it's self-explanatory. But then once we we think about, okay, these are the root causes. Well, how do we address them? So the model tells us that we need to look at the institutional inequities. We need to look at how corporations and businesses or government or schools are running the show, if you will, and what kinds of regulations, laws, and policies they may have. And that also involves or not-for-profit organizations or community-based organizations. The next level of this framework is to look then at the living conditions. And I think this is the comfort zone of urban planners, particularly when it comes to physical environment, because we are experts at advising or making decisions as to land uses, types of transportation, types of housing. We can address or we can also perpetuate residential segregation. We can also allow or prevent the exposure to toxins in our communities. For those of you working on community development, you may also have an opportunity to think in terms of the economics of who lives in your communities, in terms of metrics like employment, income, the types of businesses that may exist, and the types of hazards that people may experience through the work that they perform. And then we have social environment, and that is another area that planners need to be aware of, and that is how people in your communities are experiencing race relations, class relations, race, gender relations, and certainly immigration relations. And today that is a big topic, a big national topic. And that also has to do with or communication, how we inform, or how some organizations may be misinforming or disinforming. All this is part of being aware of the complexities that we have to address as we make our plans. And finally, the service environment. And healthcare is one very important piece, and certainly public health professionals are experts as what the dimensions of healthcare are, education, and social services. Now, what I like to bring to your attention is that for all of these to work, it's absolutely essential that we build and foster strategic partnerships in work on advocacy, so that eventually we can make the changes that we want to see in our community, so that people can be as healthy as they can. And that can be done through community capacity building, community organizing, and civic engagement. And you all are very familiar, very well versed on how it's done. At the end of the day, our goal should be able to look at the type of policy that can help us make real change. What are the types of guardrails that we can put in our plans so that people don't get sick, so that we don't put people at risk of checking out before their time. And Tiffany is going to talk to us about policy in a few minutes. Now, to be able to understand this idea of environmental justice, we put together this diagram to do an analysis of what exactly does that mean, because we hear people talk about environmental justice, racial justice, climate justice, health justice, you name it. And we started to ask the question, well, what does exactly mean? So we did a little bit of research, and justice has different dimensions. So I'm going to walk you through this diagram. And we found that to think about justice, there may be different players, and you can think of them as perpetrators and people who are aggrieved. And there may be a player who may be an arbitrator to determine what justice is. In sometimes our policies, in our laws, are the ones that help us to make those determinations. And we have a system of justice, but it applies at different levels. So you need to be aware that when you talk about justice, you have to know that justice can be distributive, and that means giving all members of society a fair share of the benefits and resources available. There is restorative justice, and this means, or it is concerned with healing the victim's wounds, in restoring offenders to law-abiding lives, in repairing harm done to interpersonal relationships and the community. And then we have retributive justice, and it means that people deserve to be treated in the same way as they treat others. And procedural justice, and this is actually the type of justice that is referred to, the type that planners should focus on. And this means making and implementing decisions according to fair processes to ensure fair treatment. And planners are very good about processes, especially when it comes to general plans, and also current planning. And what you want to remember is that procedural justice has 4 different components, and you can see them here: fairness, and it means being fair in the processes with dignity and respect; voice, providing opportunity for all parties to speak and be engaged; impartiality, in this case the moderator is neutral; and transparency, the full visibility into all processes, with the end of building trust. And finally, I like to make you aware of 2 APA resources. One is this quick notes of dimensions of equity. And what is really funny about these quick notes is that around the time when we completed our model, APA published these documents. So I think last year, or maybe a year and a half ago, we did a joint webinar in which we explore the dimensions of equity that you see here, and also the model that I shared. And also, please remember that APA has a planning for equity policy guide, and that is an amazing document that can help you learn or go even deeper into how to apply an equity lens to your daily work. And to introduce our next speaker, I have 1 minute. I just want to say a few words about Tiffany. I met Tiffany a few years ago, soon after SB 1000 was adopted, and she's going to tell you about SB 1000 in a minute. But Tiffany was the lead planner in an organization working on a toolkit for planners to know how to implement this new law, which is intended to address many of the ideas and the concepts and the principles that you saw in the document. And now Tiffany's with Ramey and Associates, and I'm just going to pass it on to her. Thank you so much. Tiffany, take it over.
Great. Thank you so much, Miguel. That was a really great background to talking about my talk today, which is about the SB 1000 law and how to integrate environmental justice into local planning work using tools like the general plan. And this really builds on Miguel's previous slide that was about the different forms of justice, right, that planners can implement through their local planning work in partnership with communities. And as Michael mentioned, I was a part of the California Environmental Justice Alliance, which was a statewide coalition that works to achieve environmental justice policy solutions for all Californians. And we were one of the main sponsors of the SB 1000 law in partnership with the Center for Community Action Environmental Justice, or CCAJ, who is based in the Inland Empire. And together we helped get this law passed to make sure that every city and county in California has an opportunity to plan for environmental justice to uplift everyone's health and well-being. And so one thing I like to point out is that people often ask us, well, what is EJ? What does it mean to address EJ in planning? And in really simple terms, a lot of EJ groups like to say that EJ is really just about the basic right of people to live, work, go to school, play, and pray in a healthy and clean environment. In other words, you're really looking at which communities have the biggest environmental burdens and other kinds of health or socioeconomic vulnerabilities. And we're working to make sure that we prioritize those communities for greater investments and improvements in their neighborhoods. The state of California also has a more official definition of EJ, which is another bill, AB 1628, that's helped pass back in 2019. And this definition of EJ focuses on both the fair treatment part of equity and justice that Miguel spoke about, and the meaningful involvement piece of environmental justice, in which people of all backgrounds, of all races, cultures, incomes, and national origins can be involved in the development, adoption, and implementation and enforcement of EJ laws, regulations, and policies. So when it comes to EJ, this law further delineates EJ to include the availability of a healthy environment for all people, the need to deter, reduce, or eliminate pollution burdens for all people, especially those who experience disproportionate burdens, how government entities can provide technical assistance and capacity building to ensure that the people most impacted can actually participate meaningfully in the decisions that impact their lives and well-being. And it also makes sure that we consider the recommendations of people, especially people who live and reside in disadvantaged communities, when making environmental and land use decision-making. So seeing how equity can be addressed both through people's outcomes in life and also through this concept of like procedural, distributive justice, et cetera. S1000, if you're familiar with the law, has a couple of requirements. It requires jurisdictions to include an EJ element or integrate EJ goals, policies, and objectives into their general plans. The requirements are to reduce the unique and compounded health risks in disadvantaged communities. And one can do this by reducing pollution exposure and improving air quality, promoting things like public facilities, healthy food access, safe and sanitary homes, and options for physical activity, which can range from, active transportation infrastructure to making sure that people have fair access to recreation and parks and open space. The law also says that we should promote community engagement in the public decision-making process, and that's both in the SB 1000 process and in the types of goals and policies and actions that you create through SB 1000. Last but not least, the law talks about how to prioritize improvements in programs that can address the needs of disadvantaged communities, or DACs, when creating your SB 1000 goals and policies. So while these are the basics of SB 1000, it should be noted that this is kind of a floor, not a ceiling for what you can accomplish, and that everyone can address SB 1000 through addressing the local needs that communities experience on the ground. And so What's common is that in S1000, people also address issues related to climate vulnerability and climate justice. For instance, making sure that people address the impacts of wildfires on communities, extreme heat, things related to climate like mudslides, sea level rise, and other kinds of extreme weather events or other kinds of disasters. Cities and counties can also include health equity in their EJ elements and be a health and EJ element. Some general plans I've seen have addressed access to health care, access to health resources and education around health, ways to reduce disparities related to mental health, physical health, spiritual health in their general plans. And there's also ways to address equitable economic development in the EJ element so that people can have access to high wage, good jobs with benefits, different kinds of career paths, and even green job career paths to make sure that we are moving away from fossil fuel and extractive economies to things that are more regenerative and focusing on healthy, clean, resilient environments. When thinking about how to implement S1000, you can think of it in some basic steps, right? There's a 3-step process that Raymond Associates focuses on. First of all, we look at what are the biggest EJ issues and socioeconomic health vulnerabilities, excuse me, in your city or county, and work to identify disadvantaged communities. Sorry, excuse me. I'm recovering from COVID, so working on staying healthy. Next, you can also make sure to take this data and engage with members of the public, especially people of disadvantaged communities, to get their feedback on this DAC map and also the EJ goals, policies, and data that you have collected. Third, you can make sure to integrate EJ goals, policies, and programs into a draft form that you can run by the public for their feedback. In the S1000 law, there are 2 ways to define disadvantaged communities. One is by looking at the DAC designation through SB 535, which is a state law that looks at the CalEnviro screen tool and sees communities, if they're over the 75th percentile of an overall score, those can be the most overburdened communities that you want to take a look at. The tool also, or the SB 35 law also looks at low population and high pollution score census tracts, that while there's not enough data to make sure it's a robust population analysis, they recognize that there's high pollution burdens in those census tracts. SB 535 also identifies areas that have previously been identified as disadvantaged communities according to the 2017 designation. And it also identifies tribal nation lands as disadvantaged communities. The second definition of disadvantaged communities also looks at whether or not an area is both low income and an area that disproportionately is affected by environmental pollution and other hazards that can possibly lead to negative health effects, environmental issues, and degradation. This definition is expansive because we recognize that sometimes one tool cannot capture all disadvantage in a community, and that there's other local data, especially locally identified data and community data, that can be used to overlay on top of tools like CalEnviro Screen to identify the best ways to seed disadvantaged communities for your city or county. So there's flexibility within the law. Not going to go over this in detail, but you can see that there's 21 different indicators for CalEnviro Screen. They break down into 2 categories. One is the pollution burden indicators, and the other is the population characteristics. You can look at this CalEnviro Screen both as a tool that does cumulative burden analysis, that looks at all these indicators together to identify like cumulative burdens. But you can also take these indicators apart and look at individual indicators. You can look at county or city data and really assess whether or not certain census tracts are rising to the top more than others. A method that we like to use at Raymond Associates is, first of all, looking at the SB 535 designation and seeing whether or not communities are lighting up using that tool. Second, we look at whether what is low income for that county or city, looking at either the state or county area median income. And then we look at different CalEnviro indicators like impaired water bodies, groundwater threats, or traffic density, PM 2.5, et cetera, to see whether or not those indicators are lighting up as very high and overburdened for the city or county. Next, we also look at locally identified data, like other tools, other data sources, locally identified data, to overlay that on top of the low income and pollution data from Cal Screen to see like what could be the composite map they would create of disadvantaged communities for the city or county. And again, it's really important to run these maps by the public, especially disadvantaged communities, to see whether or not this data is representing their lived experiences on the ground. Another tool I like to lift up is the Healthy Places Index, which is very frequently used by public health community members, which looks at not only some of the indicators in Cal Screen, but other important indicators like educational attainment, social indicators such as voting percentages, transportation indicators such as active transportation or active commuting and car access indicators, and neighborhood indicators based on pollution scores. Another aspect of community of SB 1000 that's really important to take a look at is ways in which you can integrate community engagement into your planning process. So for instance, I like to use this tool that was created by the Movement Strategy Center. You can also use other spectrums of community engagement by IAP2 and other institutions to look at how can you involve different types of community engagement strategies into your planning process. This one actually goes from ignoring people at the very low end, at the 0 level, to community ownership at the level 5 level, to show how there's a big spectrum of ways in which city decision makers can involve the public in your planning process, such as SB 1000. I think it's really important to look at what kinds of intentions you have around community engagement and what could be the possible impact of that community engagement process with the public. For instance, if you're just providing information to the public for a decision-making process, that might be good in some ways, but it can be harmful in some ways because you're not actually giving people a chance to weigh in on the decision. You're just informing them of the decision. Similarly, there could be ways in which you consult with the public, but you don't actually include their voices and their feedback in decision-making. And that could be an impact of tokenization, right? So we say we care what you think, but we're not actually going to include your ideas or thoughts in the final decision. When you're looking at levels of involvement or collaboration in public involvement processes, you're really making sure that people's feedback is informing how decision makers think and is informing the final outcome for your planning process. And so really want to make sure when we think about community engagement, what kind of impacts we're having on the public. This is a really quick example by the Center on Race, Poverty, and Environment, or CRPE. They're based in Kern County, and they created this simple 6-step process to inform decision makers on how to meaningfully include people in a public decision-making process related to like planning. So for Kern County, it's important for them to dedicate sufficient funding and staff time and outreach before the meetings, and provide resources to make sure that people can access the meetings in both English and Spanish. They want to select venues that are accessible by public transit, and they want to make sure that meeting materials and food and quality translation is available to people joining the meeting. When you're creating your plans, another issue is thinking about how you can develop language that ensures more likelihood of implementation versus language that could be kind of vague or squishy and might not lead to actual changes on the ground. So some language that might be seen as more vague or not as directive is things like encourage or do something where feasible, right? Because that kind of language, while it is important to be flexible in your general plan, it's also hard because it might not be as implementable. Directional language that's a little bit more clear is things like provide, require, mandate, etc., that ensure that you're going to abide by these policies or actions in your general plan. Additional strategies for making sure you can have implementable general plans is creating implementation plans, which can be done at the end of your EJ element or as a general plan as a whole. I've also seen many ways in which cities or counties create strategic plans, which look at all your plans in totality and create a timeline and allocate budget to make sure you're implementing your plan. I know we're running out of time for our webinar today, but I did want to share a couple of examples from Raymond Associates' work on ways to address EJ in general plans. So Palmdale 2045 is an EJ element that we worked on to create a healthy and an equitable and healthy communities element. It has different goals and topics. For instance, there's one goal focused on air quality and respiratory health, which focuses on how to create a city designed to improve air quality and reduce disparate health impacts. And this EHC 12.4 policy focuses on sensitive land uses. And so it's talking about ways to avoid citing sensitive land uses like schools, daycare facilities, playgrounds, etc., away from areas that create localized air pollution sources like, highways and industrial facilities. And so it actually requires or encourages, a certain kind of buffer distance away between sensitive uses and localized sources of air pollution. And then also creates other recommendations to install HVAC systems, create HEPA air filters, and situate these kinds of improvements away from polluting sources to make sure that people have access to healthy air within their homes. Other goals within this equitable and healthy communities elements for Palmdale include goals around community engagement, for instance, creating a youth council, and also ways to promote better healthy food access. So making sure that people, no matter their backgrounds, can access affordable and high quality fruits and vegetables. And the one policy example that we have here is working with farmers markets to not only provide good, healthy local food, but also be able to accept public benefits to access that food. Another example is the Culver City General Plan 2045, the community health and environmental justice element, which provides different kinds of goals and policies. For instance, this one focuses on physical activity, which ensures that residents of all incomes, ages, and abilities has opportunities to lead active lifestyles. One thing to note about this element is that, like all other elements, EJ is an intersectional issue. So while you're looking at physical activity, this element does recommend that you look at the parks, recreation, public facilities element for more goals and policies related to this physical activity goal, right? That's another way you can cross-reference the EJ element with other elements. Another part of this community health and EJ element for Culver City focused on housing economic uncertainty. And so one policy is about how to ensure or how to promote limited equity housing. So encouraging resident-controlled limited equity ownership, such as limited equity condominiums, limited equity cooperatives, and community land trusts to be built in Culver City to have a better way for people to have housing stability and affordable housing. Last but not least, before I end this conversation today, did want to point out that while there are different ways in which EJ is being discouraged by different kinds of federal initiatives and executive orders, the state of California and many other states across the country are still advocating that EJ is an important thing to be addressing from local planning to statewide efforts. And so there is this multi-state guidance created by the state attorney general of California, among other attorney generals across the country, that are kind of really showing that EJ is important to be achieved and that EJ is actually a part of current law from not only state law, but also some kinds of federal law. And so the guidance focuses on that efforts to advance environmental justice remain essential, that federal actions do not impact the legality of EJ efforts, and that there are still distinct obligations to tribal nations, indigenous peoples to address environmental justice, and that there's many ways to achieve EJ in practice. So if you have any more questions, feel free to put them in the chat. Look forward to the conversation today. Thank you.
Great. Thanks, Tiffany. Thanks, Miguel. So you do have a few minutes before the end of the hour for any questions folks may have about the topic, about the presentation. So as you can see on screen, we do have a Q&A function in this webinar tool. So looks like there are a couple questions already in there. So I'll read them out loud for anyone who can't see them. Let's see. So this first one is for Miguel. I'll try to summarize. As a planner working in the intersection of urban planning and public health, What guidance would you offer to emerging professionals who are navigating growing public distrust in government institutions and increasing skepticism towards science and evidence-based practice?
Great question, Michael. And I know Mo, it's too bad she had to jump off. What I would say is that to be able to respond, you may want to think about the model that Tiffany shared, the spectrum of community engagement model. Just try to put that in your minds. I know she went through it quite quickly, but to be able to actually dive into how to make that model work, I would say there's a few steps, especially for younger planners, and they need to be able to do these things. They need to be willing to go into the communities. They need to be on the street. I wonder if some of you may know the work of Jonathan Pacheco Bell, who came up with this idea of embedded planning, which means that you should not be doing all your planning at your desk. You need to go out into the community. And when you go out into the community, you just don't go to meet people once. You are going there to get to know them. That is your mission, to really get to know people, because that's how you build trust. So once you go out into the streets, what you want to do is to learn from them. And it's a simple process. You do it by asking. Perhaps the question is, what can I do for you? How can I help you? That could be an answer that can be a good way to get the community that you serve to open up. You need to listen. You need to let them speak, let them tell you how they feel, let them tell you what they think. And once you have that information, you should do something with it. You should not just say, oh, thank you, bye, see ya. No, you should do something. And whether you do something with that or not, you must follow up with them. You must go back and tell them whether you were able to do something about maybe an idea or an issue or a problem, or that you couldn't do it and you want to be respectful by telling them that you did your best to get something done. And that process is circular. And you don't do that just with one person. You do it with as many people as you can. So that would be my answer. It's a lot of work. It's community engagement is probably the hardest work of a planner. Making a plan is easy. Implementing a plan is easy. You have a blueprint, but community engagement is very tricky, but that would be a good way to start. Maybe Tiffany, if you'd like to add something.
Thanks, Miguel. I thought that was really, really helpful to talk about how to build trust with the public, because, we talk about, oh, people don't trust science, people don't trust decision makers. Really deeply listening to people is so crucial to building trust. And once you talk to people, you can kind of get like at the heart of what are they really distrusting, right? Like, what are they really concerned about? Is it that they had a bad experience with someone in the past and they want to like break through that cycle of bad experience with that decision maker or that government entity? Is it that they don't trust the word climate, but they do care about health, or they do care about access to opportunities, right? I think it's trying to figure out, these are the same concepts, right? But slightly different language or slightly different angle. How can we find a common ground in our language so that we're getting at the same things that we all care about, right? And I think that's kind of echoing some of the other questions in the Q&A too.
Yeah, thanks, Miguel. Thanks, Tiffany. There is a follow-up question from Mo as well, very related to the first question. It's a bit of a lengthy one, so I'll try to summarize it. So basically, given dismissal of climate science and EJ policies at the federal level, how should professionals in urban planning and public health respond to high-level political attacks on climate science and evidence-based policy? And basically asking what strategies can help maintain integrity, public trust, and forward momentum to address climate change and human health.
Mm-hmm.
So
Yeah.
a little sorry, go ahead.
No, very relevant to the last question. I totally hear that. I think another tool that's very commonly used in a lot of community work, in addition to like obviously deep listening and having authentic conversations with people to like learn about their past, learn about their experiences, learn about their opinions, is storytelling. I think there's so much power in giving people examples of real life or using examples of people's lives themselves to kind of get better access to these concepts that can seem really wonky or distrustful. So I think, again, having ongoing conversations with the public, with certain community members is really important to know, like, what are the things that they're facing, and then using storytelling and examples to show how these things impact people in real life, right? One example we try to talk about is like, oh, some people might not care about EJ. Like, why do I care about EJ? We can be like, okay, has anyone in your family ever gotten cancer? Has anyone in your family ever had like an asthma attack? Or do you know someone who's had asthma issues? And this is where the public health tie is really important, right? Have you ever had a hard time accessing public transportation, going to school or work? Have you ever had a hard time um, because you live near a high volume roadway and you're getting particulate matter, black soot dust on your windowsills, and you're having a hard time crossing the street, right? I think it's important to like connect people's lived experiences to some of these issues and then back it up with some data. The hard thing with trust, that trust is something built over time, right? So it's repeated examples of positive interactions, building relationships and rapport with people, getting to know each other, having it be a two-way street of relationship building, right, is where you start to really build that trust with the public. You also have to show results, frankly. I think showing the ways in which planning has made a difference in people's lives, whether it's a procedural issue or it's a distributive justice issue, is also really important, right? I give the example of certain kinds of state programs where even though they haven't shown reductions in pollution yet, the fact that air districts and local plan departments and the health departments are going out and talking to people and giving them information is really important because they're seeing a change in the way that their feedback is being heard on the ground, right? By showing those different kinds of progress, like celebrate all the progress, celebrate all the accomplishments you have, because those little wins add up to bigger wins in the future and start to build the trust. And I don't be discouraged if people don't have trust right away. People have gone through a lot of trauma over the years or decades that they want to have heard. And even though we might not be personally responsible for that trauma, I do think it is our job to listen to people and to make sure that their voices are heard, right? Because once people can move through those hard emotions, they can start to replace those hard emotions with other things like trust, better rapport, better relationship, learning, right? People need to feel like they're heard and seen in order for learning exchanges to really occur authentically.
Thanks, Tiffany. Great answer. Miguel, I know the question was directed at Tiffany, but anything else you'd like to add to that?
Yeah, absolutely. I think the short answer is we're not going to turn our back on science. We cannot. It's part of that's what we signed up for as planners. And if you look at the code of ethics, it may not be expressed as such, but we are guided not only by facts, but also by the processes that we employ in our work. I think there's different opinions, and that's part of the decision-making process, because whether we like it or not, the people who make the ultimate decisions, they not only rely on the expertise and the science that planners or public health professionals bring to the table, but there's other considerations. And sometimes they may be political considerations. And that's how our system is designed. And I think we need to continue to pursue using data. Evidence-based decision making is what is going to keep us sustaining ourselves over time. I think the fact that we have an environmental justice element in the state of California is an amazing tool to be able to do this type of work, to bring science to the table. EIRs are not going to be based on people's opinions. They're going to be based on science. They're going to be based on numbers. And if you work in transportation, if you work in other areas related to where you need to quantify numbers like air quality, you will continue to rely on science. So science is our friend.
That's a really good point, Miguel. And one thing I do want to emphasize is that I do recognize that a lot of cities and counties do feel the need to kind of comply in advance due to fear that they might be attacked or have federal funding taken away. And I don't want to downplay any of those fears. Like, that is definitely real, right? That has very concrete impacts on people's lives on the ground, right? It impacts your ability to serve the public. If there's a way to both advance these concepts and goals and be safe with your city or county, I think that's a really nice happy medium. Because the moment we stop talking about environmental justice, health equity, and justice is when we kind of give less attention to those initiatives, programs, and policies. And that becomes very dangerous, right? Because there's less momentum to addressing these important things that really make sure that everyone has access to a healthy, clean, and safe environment. So I still advocate for people to address environmental justice in language in addition to in policy and program. There's many ways to address EJ without saying the words EJ or equity, but at the same time, we're kind of addressing many different threats on multiple fronts, which is both the policy front and the messaging front, right? Of what's important, what's valued, and what's even legal in our work these days.
And I
Awesome.
can just say
Oh.
one last thing to add
Please do.
is that the day we're going to stop talking about EJ, environmental justice, is the day when injustices are gone. That's the bottom line.
Well, as we get to the end of the hour, that was a good statement to sort of end the session on. So thanks, Miguel. So as we do get to the end of the hour, I did see that there were 2 questions typed in from one Tiffany, for our Tiffany. Looks like Tiffany answered them via chat. I just want to point out that there is one reference from the state you linked in there, the environmental justice guidance. So folks interested in reading up more about the state guidance, that PDF is the way to go. But with that, given that we are at the end of the hour, I did want to thank Miguel and Tiffany for sharing their knowledge and experience with us today. The webinar recording and the slides will be available soon on our website at ocapa.org, as well as any other webinars we've done in the past should all be available there as well. Also, did want to point out this session does qualify for 1 Equity CM credit, so please use the event ID on the screen, 931-7601. On the Planet.org website to get the CM Equity credit for this session. And with that, I want to thank everyone for being here today and thank our presenters, and everyone have a great rest of your day. Bye, everyone.
Bye.
Hi, sorry, I'm not quite sure how to end the webinar.